PCOS is a topic that I've been interested in for a long time, and when I was doing my Masters in 95 to 99, the topic of my minor thesis was the effect of acupuncture and Chinese herbs on infertility due to PCOS. So I've maintained an interest since then, and I do see quite a lot of women in practice who present with PCOS, and sometimes they present and it's the clinician who is, I'm often the clinician who is suggesting that it is that they do have PCOS. So what I am going to look at today is what women are, how many women with PCOS are actually using complementary medicines, and there was a recent review that has done this very nicely for me. And I'm going to look at a review of the evidence of what is available in terms of natural therapies, and we refer to them as CAM. That's the way it's referred to in the literature, complementary and alternative medicines. And there is some research that is strong and there is some research that is not as strong, and I'll try and point out which is which. And the way that I will discuss treatment will also be the way Rosie did in terms of treatment as if presenting complaints. So there was a recent review that looked over at about 493 women, and the women were mainly recruited from a support group, and then there was a secondary sort of call from social media, and most of the social media people came from New South Wales and Sydney. And most of the participants were aged between 25 and 34, Australian born, had tertiary qualifications, they were employed and held private health insurance. And you can see that over 70% of these women had used complementary medicine in the previous 12 months. The breakdown of that, so just under 60% had used dietary supplements, and they specified fish oils particularly, but otherwise it was just vitamins, minerals and food supplements as well as herbal supplements. Just over 40% had used herbal medicine, including herbal tea, for therapeutic reasons, not just a cup of peppermint tea after dinner. But you'll see that one of the interventions that's often looked at for hirsutism, particularly in Middle Eastern women, is spearmint tea. And the research that I'll present later on is actually done on a spearmint tea bag. So it's interesting that they talked about this for therapeutic reasons. And just over 14% used vitamins and minerals prescribed by a doctor, and just under 50% had reported using more than one complementary medicine, and that's pretty consistent with what you would see in practice. This is the breakdown of when they saw complementary medicine practitioners. So just under 80% had actually seen a CAM practitioner in the previous 12 months. And you'll see from the breakdown that the majority had seen a naturopath, followed by a chiropractor and then an acupuncturist. And just under half, about 44.7%, had seen more than one complementary medicine practitioner. And so about just under 40% saw a naturopath, 33.9% consulted a chiropractor, and it goes down from there. And so it gives you an idea of what women are using, and indeed that women are coming and they will be using some complementary medicine, and also they will be seeking help from a complementary medicine practitioner. So as per the Australian guidelines, as a clinician, we do follow the same sort of guidelines, and the primary aim is to deal with the insulin resistance, as the majority of times that's what is present. And so as per the guidelines, we try and implement a 5 to 10% loss of body weight, and we know that that really improves the metabolic and the reproductive features. Diet and exercise are the ones that are often looked at, and diet is more effective than exercise, and this is stated in the guidelines. The difference is, I guess, the way we would implement dietary changes compared to perhaps what you might do. And we do focus on moderate carbohydrates, reducing it, not completely reducing them at all, completely, and a moderate protein and particularly essential fatty acids. So when you're looking at that, it's going to be more than the calorific intake that's specified in 1200 calories per day. But women tend to lose weight and they're able to stay with it because, particularly with adding in a bit of extra good fat, it gives them that feeling of satiety. So particularly the essential fatty acids, fish 3 times a week, and nuts. And there's some good studies on nuts generally, not very specifically with PCOS, looking at decreasing all-case mortality, but also in terms of patients with diabetes, tends to improve their metabolic factors and particularly their lipids. So including a handful of nuts can be quite a good way to get through the morning. So almonds, walnuts, there's a small study that was actually done comparing walnuts and almonds in PCOS patients just recently. And both of them reduced LDL cholesterol. The walnuts tend to be more favourable and that they've got a greater amount of the omega-3 fatty acids. So we would look at making sure that there was moderate protein and essential fatty acids and reducing the carbohydrates. Exercise, as you probably know, enhances weight loss. Diet is more effective than exercise, but it independently improves that insulin sensitivity and will improve menstrual regularity on its own. And then regular exercise is encouraged to prevent further weight gain. If we look at addressing the concerns that the patient comes in with as well, of course, insulin resistance is often looked at overall. And the things that I will talk about other than diet and exercise, I'll explore what's the evidence with cinnamon. There's some interesting pieces on chromium, omega-3 fatty acids as well. I'm not going to talk about alpha-lipoic acid, but it might be something that you see that your patients are talking about, that are using. It is an antioxidant, and in diabetic patients tends to have an effect in improving glycemic control. But there is very, very little research specifically on PCOS women, like the numbers of patients in the groups that are studied are under 10. And it's often studied in the Italian studies where they're using inositol as well. And it's often done with lean women who have got the insulin resistance. So it is something that's used as an antioxidant. There is some evidence in terms of helping with fertility, but really, really small numbers, particularly with PCOS. And magnesium is something you'll see clinically used as part of glycemic control, but again, no evidence really in terms of PCOS specifically. With the hyperandrogenic features, the hirsutism and acne, there are a couple of anti-androgen herbs that we look at. Again, there's not a lot of research particularly for PCOS, but I will explore them because clinically they do seem to have some benefit. And zinc has some value as well, and I'll talk about that a little bit more. With acne, we don't tend to focus on the anti-androgen treatments. In practice, what seems to work better is zinc and vitamin A, and there is some evidence showing that when patients with PCOS take chromium, their acne score does improve as well. And as we know, the whole kind of pathophysiology with acne is quite insulin driven. And then when you're dealing with a low GL diet, for example, a low glycemic diet, that does improve acne overall. And the insulin has a driving factor on the way that the androgens increase the sebum production and the inflammation and invite the bacteria in. So looking at it from a balancing out and addressing the insulin resistance does seem to work. And that's why chromium will work, and you'll see when we talk about chromium. And then the anovulation and infertility issues. There is quite a lot of information on inositol. I must say I've only ever used it once, and it's quite difficult to get my head around it, but I'm going to present the data on it, and it may be useful particularly with a whole range of PCOS factors, but I'm talking about it here with anovulation. And there's a traditional Chinese formula, peony and licorice, that's used a lot in practice that does tend to help with a number of factors around PCOS. And while we think of black cohosh mainly for menopause, there was a study that I'll look at where they've combined clomiphene and black cohosh to improve the rate of pregnancy in PCOS patients. So let's start first of all looking at the nutritional and herbal treatments to address the insulin resistance. So cinnamon, good old cinnamon. Now be aware that there are many different species of cinnamon. So the cinnamon that's mostly in the research is cinnamon cassia. And I know when I was doing this, I went and looked at my lovely organic cinnamon that I put on the porridge, and it wasn't cinnamon cassia. So if you want to be specific, you need to make sure that it is that species and not one of the other species. So again, cinnamon's looked at a lot in the research with diabetes generally and insulin resistance, and it tends to have a positive effect in treating insulin resistance in type 2 diabetes, and the mechanism's not completely understood. But as you'll see here, there's two studies with a total of 60 patients where that's the number of patients that have been looked at specifically with PCOS. And the dose seems to vary between about the first one actually looked at only 1 gram, and it reduced fasting glucose as well as insulin resistance. And the other one was looking at 1.5 gram a day over 6 months, and it improved cycle regularity. Now, the dose tends to be about 2 to 4 grams a day, really, and that is about equivalent to half a teaspoon to 1 teaspoon a day. So if you look at first do no harm, if you're encouraging someone to use cinnamon on their porridge, now half a teaspoon to a teaspoon is quite a lot. You know, a teaspoon is often what you'd use in a whole cake. But if you're encouraging that as part of their diet, it does no harm, and it will probably be of some benefit. These are using tablets that are often using the 1 gram, which can be available, but I would imagine that there's going to be more information available about cinnamon. Chromium is a mineral that is an interesting one, and up until the last few years there wasn't very much research, particularly on chromium and PCOS. It forms part of glucose tolerance factor, and this promotes sufficient insulin function. And it seems to improve the insulin sensitivity at the insulin receptor level. There are different types of chromium, and the chromium that is the best form is chromium picolinate. And so there are other forms of chromium that you can get over the market, but all the research is done on picolinate, and it is the best available form. Dietary chromium is very poorly absorbed. Things like brewer's yeast tend to have a little bit in it, but it is a very poorly absorbed. The dose tends to range, it's quite a large dose range, 200 micrograms to 1,000 micrograms, and the authors talk about, oh, well, you know, they haven't used enough and the 1,000 micrograms is going to be better, but as you'll see, even with 200 micrograms, it can actually be beneficial. So the most recent ones where they're looking at a paper, a study with 100 women using 1,000 micrograms, it improved insulin resistance, fasting insulin levels, body weight, induced ovulation and regular menstrual cycles in PCOS patients. So this is probably something that women are aware of or will be self-prescribing with. The next one looked at a much lower dose, 200 micrograms, and again this was just under 100 patients over 3 months. Decreased fasting blood sugar and insulin levels and increased insulin sensitivity in clomiphene-resistant PCOS patients over 3 months. They had an arm where the patients were also taking metformin, similar results, but the patients who were on the metformin also had a decrease in their hyperandrogenism symptoms. And the other one is looking at a higher pregnancy rate comparing it to placebo with 200 micrograms over 8 weeks. And you can see that there were 5 pregnancies compared to 1 in the placebo group. I'm talking about omega-3 fatty acids because it was one of the supplements that was particularly listed in the prevalence of CAM use in PCOS patients. And omega-3 fatty acids, there is some emerging research looking at how it might improve insulin sensitivity, particularly in PCOS patients. But in that one, where they looked at improving the insulin sensitivity, there was no positive effect on weight or BMI or waist circumference. In other studies, there have been some changes. There's some limited evidence that it might actually be useful for hirsutism. So fish oils, they provide us with omega-3 fatty acids. We tend to have more of the omega-6 in our diet, and we tend to have an imbalance. People use them as an anti-inflammatory to help to modify lipids. And it seems that women are using this particularly as part of their management with PCOS. The suspected mechanism is that it helps with the way that the insulin the glucose is transported into the cells, and also the fact that it is anti-inflammatory. And some of the theories about PCOS is that it's an inflammation. I mean, I think the latest thing is all non-communicable diseases are a result of inflammation. And so where PCOS is, if there's theory about inflammation and there's increased pro-inflammatory cytokines, then the omega-3 fatty acids decrease that. And that's some suggested mechanisms that were discussed in a paper looking at it specifically for PCOS. If we look at how we manage infertility and oligomenorrhoea, again, the main thing is to improve ovulation. So if that means that we are going to do that by this 5 to 10% loss of body weight, that's great. We do it with diet and also with exercise. Now, I also need to mention is that with this, if women aren't having these 4 bleeds per year, we really need to send them off. So if we're not re-establishing ovulation and they're not having these 4 bleeds a year, there's nothing really effective that naturopaths can do, and they will need to be referred off to a GP for a progestin, for a withdrawal bleed, or whatever the treatment. So it's something that we are aware of if we can't re-establish ovulation. So I talked about this particular formula, peony and licorice. It's a traditional Chinese medicine, and that's used, and there was a study that was done quite a long time ago now, but it's still used a lot in practice, where it reduced testosterone and improved estrogen to testosterone ratio after about 4 weeks. And the proposed mechanism that it increases the aromatase activity, so it's driving the testosterone into being driven into aromatized into the estrogen, and it tended to improve pregnancy rates as well. The licorice, that little formula is how we would use it in a fluid extract. That's the equivalent that we would use if the patients weren't taking the Chinese formula. Now, this little white powder that I'm going to talk about is this inositol. So, if you do a search on inositol, and I did a Medline search yesterday, and there's about 87 papers that come up on inositol, and particularly with PCOS. And there seems to be most of the research is done in Italy, and they tend to use it for a variety of reasons. So what is it? It used to be referred to as a B vitamin, but it can't be classified as a B vitamin. It's a polyalcohol existing as 9 different stereoisomers, and 2 of them, the myo-inositol and the dichloroinositol, are the ones that have shown to be insulin mediators. And a recent consensus, an international consensus that was again held in Italy, looking at what inositol does in obstetrics and gynecology, had determined that probably myo-inositol is superior, particularly for PCOS, and probably superior on the ovarian level. And so they are insulin sensitizing, and they're second messengers of insulin. Now, I put in the mechanism there because it seems that the myo-inositol is converted to this inositol phosphoglycan, or an IPG, insulin's second messenger, which is involved in cellular glucose uptake, where the other one, the dichloroinositol, is converted to an IPG, insulin's second messenger, involved in glycogen synthesis. Now, the users of this tend to report about there's an impairment in insulin signalling in PCOS women. This is one of the theories. And it's to do with the fact that these IPGs, there's some sort of defect in that. And so by using this, it's fixing that. So I still haven't got my head around it, but there seems to be a number of papers looking at it. And I think I've used it once in practice quite successfully. And they do actually use it as a white powder, and it's weight for gram, weight for weight. This is a review that was done in 2014, and the author here talks about the studies looking at 70 studies, and the criteria that meets good randomised controlled trials are 6, and it involves 300 patients totally. The dose that's looked at is 2 to 4 grams, and it's this Italian formula that has folic acid in as well, mainly because it's in preparation for pregnancy. And overall, it improves insulin sensitivity of the target tissues, resulting in a positive effect on the reproductive axis. It restores ovulation and improves oocyte quality and hormonal functions. It also tends to have a positive effect on the clinical and biochemical symptoms and signs of hyperandrogenism and dyslipidemia, and it does that by reducing insulin plasma levels. So he talks about that, and then I've actually listed a couple of individual papers that were done where you can see that the combination of the inositols improved oocyte and embryo quality. So they're often doing it in patients who have undergone IVF unsuccessfully, and then they improve their oocyte quality. There was another one recently there where it looked at the grade of the embryos actually improved. I think that one was combining alpha-lipoic acid. So it also tends to spontaneously restore ovulation in amenorrhoeic patients with PCOS. It has a positive effect on lipid and cardiovascular risk and cycle regularity, and also with acne score. So there's a number of papers that look at it. I guess it's kind of watch this space. I'm interested in if any of you are seeing patients that are taking it, but there does seem to be quite a lot of information on it. The doses that's used is often 2 grams up to BD, and it's often using this Italian product called Inofolic, which has got the folic acid in as well. Appears to be safe in humans, and only at the highest doses, so much higher than the therapeutic doses, where there's mild gastrointestinal side effects, nausea, flatus, and diarrhoea. Just to be aware with vitamin D, making sure patients are vitamin D replete, particularly if they are having IVF. There seems to be a better success rate with PCOS patients if they have adequate vitamin D levels, and a lower success rate with IVF, conversely, if they have vitamin D deficiency. Particularly if it's combined with calcium, there is a higher rate of follicle formation compared with metformin alone. Now, I just wanted to mention, so some of you have heard me talk before and often talked about the herb Vitex agnus castus or chase tree, and it is the herb that's usually talked about for amenorrhoea, oligomenorrhoea, and it is one of the herbs that we would often use with that. But interestingly, in PCOS, it doesn't seem to work quite so well. Now, there are two schools of thoughts within our profession, and I belong to the school of thought that have observed that if you do prescribe Vitex agnus castus for patients trying with this, particularly this oligomenorrhoea, it actually worsens cycle regularity. So they might be cycling around, 33, 34 days, and that then tends to mean that they're going more towards the 40, 42 days. So it's not really indicated. And there is in the reading we provided you with, there was a review of a recent review of the literature of CAM that one of my colleagues did, and she talks about Vitex in that as well, but there's nothing specifically with Vitex and PCOS. So there's no research at all with Vitex and PCOS, but in practice it seems to be worsened cycle regularity and it's not indicated. I mentioned the black cohosh. There is this small study that looked at where it was combined with Clomid, and it seemed to have a higher clinical pregnancy. So we see that there were 71 pregnancies out of 204 compared to 33 in the group that didn't have black cohosh with it. Now, the authors inaccurately attribute the action to Cimicifuga to phytoestrogens, but Cimicifuga is not a phytoestrogenic herb. It does not contain any estrogen-like compounds, and in fact, I know it sounds a bit conceited discussing this, but it is. What we know about the Cimicifuga is that it's probably it's serotonergic and dopaminergic. So it probably works completely in a different way. And even though it tends to help with menopausal symptoms, it's not because it's a phytoestrogen. And in fact, there are very few herbs that are phytoestrogens. If we look at the hyperandrogenic symptoms now, Serenoa repens or saw palmetto is a herb that is usually used for benign prostatic hyperplasia. So men tend to take it for prostate problems. And it has been compared to alpha, now I've gone lost. It's used for benign prostatic hyperplasia. Now, there's no studies particularly with PCOS and Serenoa, but I tend to use it particularly, what we do use it for is for androgenic alopecia for females, not necessarily just for PCOS, but it can be as part of it. And look, there was a very small study which actually looked at men and women where they used Serenoa topically, and it tended to improve the hair density and increase sebum reduction in people who had the androgenic alopecia. Now, so there's a little bit of extrapolation on that, but clinically it can actually be useful, and it may actually be useful as an anti-androgen as part of the treatment for hirsutism. But no research to support that, but it is one that's possibly worth looking at for patients. I mentioned spearmint tea. So in Middle Eastern cultures, spearmint tea is often used as a way of controlling hair growth. And looking at this study, it's actually that they just use tea bags. So they use spearmint tea bags, and I think it was twice a day, and the first one was only done for 5 days in the follicular phase. And they had a placebo group in the second one where they used chamomile tea. And it decreased free testosterone and increased LH, FSH and estradiol in a very small number of patients, 21 patients with hirsutism, of which about half were PCOS patients, but no significant decrease in total testosterone or DHEA. Some of the authors went on to then look at it over a month, and they used it over 30 days, and there was a reduction in subjective assessment of hirsutism, but no significant reduction in objective the Ferryman-Galway scale. It's a fairly benign herb, spearmint tea, and it's kind of like, again, do no harm if you're getting patients to drink spearmint. So it's not peppermint, but it's spearmint. So Mentha spicata is the Latin binomial, and it might be a useful part of their treatment if they're drinking herbal teas anyway. Acne, in practice, it tends to respond to more traditional sort of herbal treatment of using a group of herbs called alteratives and nutritional treatment rather than focusing on herbs that will look at that anti-androgen naturopathic sort of treatment. There is evidence looking at the low GL and low GI diet specifically for acne, where, as I talked about, it helps to improve that insulin growth, the insulin driving the acne whole pathophysiology. And chromium picolinate was one of the things, as mentioned before, that the acne score tend to improve. Zinc is another one that we tend to use. Again, picolinate is the form, it's not available legally in Australia for some reason. Citrate is, and so zinc ain't zinc. It's really about, you want to make sure that one that is best absorbed, and zinc citrate tends to be the best one. 30 milligrams is a good therapeutic dose, although in that brand study they actually used 50 milligrams to look at acne particularly. They were actually looking at hirsutism and a whole range of metabolic features that they see with PCOS patients. But they did talk about the reason why the zinc might be useful for PCOS, and it's antibacterial, anti-inflammatory actions, and it does decrease that sebum production. We would often use vitamin A as well, 10 to 20,000 IUs, not if a woman is trying to get pregnant because it's teratogenic, so contraindicated if a woman is trying to get pregnant. But it will often be quite useful to clinically to help with that. No evidence, no studies at all with vitamin A and PCOS patients. And topically, patients, particularly the younger girls, and they tend to like something that they can do a face wash. And tea tree oil face washes you can get sort of over the counter can be really useful, and they can inhibit that propionic bacterium, that is the bacteria that infiltrates the and is involved with the acne. So topical tea tree acne facial washes can be good. So just a couple of summarising, the primary focus is on diet and exercise. And I guess when we see patients, they are a little bit frustrated and they're confused and they don't know what to do. So putting them on the right track, getting them onto some good exercise. Of course, getting patients motivated to exercise is the hardest thing. But getting some dietary changes, particularly reducing carbohydrates, getting good amounts of protein, which help to create a nice feeling of satiety, lean meats and vegetarian sources of protein, and making sure they've got adequate essential fatty acids. And of course that will help to improve the metabolic and reproductive features. And in terms of insulin sensitising agents, there is increasing evidence on chromium, and it's probably one that we can use. And there is very little but increasing evidence that perhaps cinnamon might be useful, and perhaps encouraging half a teaspoon to a teaspoon might be a useful dietary intervention. This peonian licorice, if you're seeing patients taking that, it's because it's something that we will often use to help with more of the reproductive features, but can actually help with testosterone lowering as well. And the greatest amount of research tends to be on this inositol, so I guess watch this space in terms of that. And perhaps suggesting spearmint tea is a fairly harmless intervention that might actually be a good dietary sort of recommendation for part of the treatment of hirsutism. Thank you.